Hi, it's Dr. Paul Jared Frank. Welcome to my educational video on the UltraTight procedure. So one of the biggest fads today in dermatologic surgery or cosmetic dermatology is skin tightening. The gold standard is still facial plastic surgery. A patient would come in with sagging skin, jowls, neck fat, and overall looseness, loss of the jawline definition. Over the last several years, several technologies have come out in the dermatology field using ultrasound, like therapy or radiofrequency or lasers to really try and tighten this area non-invasively. The problem is it really only works on patients with mild to moderate looseness of the skin. So what we're looking for is a niche product, a procedure that is a mild surgical procedure but not as aggressive as facelift, one with a quick recovery, one with ease and safety, one that doesn't require general anesthesia, and does something a little bit more than the totally non-invasive devices can do. Now, although these devices I use very regularly, again, I tend to be for patients in their 30s, early 40s, or for people who are older who may have had facial plastic surgery before. But again, we're looking for something that's in between. So what I did was I developed this procedure called the UltraTight procedure. It is a modification of a procedure I've been doing for 15 years using microcannula tumescent liposuction. It's a simple procedure. It's performed in about an hour right here in my office, which is fully accredited. Patients come in, they get a small sedative like a Valium just to take away the nerves. And very much like a dental procedure, we give shots of local anesthesia into the affected area, the jowls. And I then take, through a very small hole, 1 or 2 holes, a ultrasonic wand. And instead of using the ultrasound externally, I'm using it internally. And what I'm doing is I'm melting the deeper deposits of fat and tightening and ironing the skin from underneath. So this is going to do a lot more dramatic results than a plain old non-invasive skin tightening devices. Plus, it addresses the fat. So the 2 reasons why our skin sags as we get older, it's twofold. First, we lose elasticity in the skin, and that's where the ultrasound comes into play. And we also redistribute fat. We lose fat in some areas, we gain it in others. So we want to get rid of that fat. And this could all be performed in one treatment. Now, still, patients with severe laxity still require facial plastic surgery. So like any procedure, this is not the end-all be-all that will apply to everybody. But it definitely takes us one step closer to really getting great results and delaying, if not totally, preventing us from needing more aggressive facial plastic surgery. So we have a great patient here today. It's a gentleman. This is a procedure actually originally thought of for men because this is an area that they very much think of in terms of their confidence and keeping youthful and virile. And we're going to try and do that for him today. So I'll see you in the OR in a few minutes. We're in the OR with our patient, and we're going to do the UltraTight procedure today. And again, this is something that we're going to be using to tighten up the jawline, try and straighten it out. It's a very common concern, particularly about men. They lose the definition in their jaw. So what I'm going to be doing is I'm going to be going through 2 little holes, and I'm going to show you right here, and we're going to be using local anesthesia to get him comfortable. He'll be awake during the procedure. He just has a little Valium on the board, so hopefully he'll be a good patient. Okay, so we're going to put in some local anesthesia now. Again, we're playing dentist here. He's totally sterilized. He's drawn out. I'm going to put in 2 little blebs right here. Hopefully he won't jump or punch me. This is the only kind of quote-unquote tough part of the procedure. I got to get him comfortable and get the area numb. So I will make these 2 little incisions in a little bit. But this is a very safe plane to work on. It's above the muscle. There's really no risk of getting any of the understructures of blood vessels or nerves or anything because he's awake. If I were doing anything that would cause him significant harm, he would jump and say ouch. So I will then, once I got a little bit of anesthesia in there, a little bit more aggressively fill up the area. Now, you got to get bigger before you get smaller here. What I'm doing is I'm really just kind of flushing the area with local anesthesia. He'll start to not feel anything in a second. I have to get into the jowl area. You may not be able to see all of this. But again, this is just local anesthesia. Okay, Megan, right there. And then we're just going to do this for a minute or 2, and he will sit for about 15 minutes before we get started. I want him totally comfortable and totally numb. And after that, it should be a totally bloodless procedure. And it shouldn't take more than an hour total. So we'll see you back when he's ready to go. He's totally anesthetized. Again, the area is swollen up because of the local anesthesia. What I've done is I created a space in between the skin and the muscle where I could access the fat and get underneath the skin and kind of use heat of this ultrasonic wand to iron out the skin and tighten it from underneath. So again, whereas the non-invasive technologies work from outside, we're working from the inside. Now, this is a modification of an internal ultrasound device. It really puts off a lot of heat. You can't see it, but over here somewhere I can control the energy. I'll be working in two planes. I'll be working very deeply at high energies to melt the fat, and then I'm going to be going superficially underneath the skin to tighten and heat up the tissue, build the collagen. So if you could focus a little bit more over here, I'm just going to briefly show you what we're doing here. The patient will not be able to feel any pain. We're going to run a little water to protect the skin. And you may or may not be able to hear anything right now, but what I'm doing is I'm breaking up the fat. In the deeper plane, I'll be able to come into the jowl area. And this is a bloodless procedure. So this is basically it. I'm going to be doing this for about 15-20 minutes. I'll be able to massage out any fat and do some random work to sculpt out the tissue. He's not in any pain whatsoever. And then we'll bandage him up and go over post-op. So this is really the procedure. All done through these two little holes that will close up without even a stitch. So we'll see you in post-op. Okay, so we're here in post-op. He did great. He's not crying or screaming or anything like that. He's still smiling. So we finished the procedure. I did the melting. A little bit of fat came out. We tightened the skin from underneath. This is just a bandage for 24 hours. We put some bandages under here, a little Neosporin on the two teeny holes. There are no stitches. And we put a little pressure. He's able to eat just like no steaks or apples or anything like that. He will wear this for 24 hours. He will then be able to take off the bandages, shower, wash his hair, and then maybe for a few nights he'll just sleep with this little headgear on, just to put pressure. Right now, the first few days is the most important period. We've created like sticky tape on the inside of the skin, and we want to heal against the muscle to recreate a more youthful jawline. I will see him on Monday. I expect him to be able to go to work, and I expect him to not have any pain tonight. Are you in any pain?
I'm in no pain whatsoever.
Yeah. So it's the anesthesia will last another 2-3 hours, and at most he'll feel a little sore like he had a dental procedure. We'll see Dr. Frank again. We're here for follow-up for the UltraTight procedure with our main man here. He did very well. I didn't torture you too much, right?
No, you did not.
Okay, good. He did very good. We saw him for follow-up a few days after the procedure. It's a month now, so he's very happy. We're seeing good results. He will get another 25% additional results from collagen tightening over the next few weeks to months, but he's at a point now where he's fully functional. He's certainly back to work. He did all this within a few days, like 48 hours after the procedure. But most importantly, maybe you want to come in a little closer, he has got the jawline he did not have before. Okay? This,
sure.
Yeah, and this is gone. What I think is very impressive is that he has a much straighter contour going on the front. The jowls have been completely removed. And, you know, you cannot even see the teeny holes that were made for this procedure.
They're practically invisible.
Yeah, so no bruising, relatively painless procedure, easy recovery with minor soreness, and it's a month later, and he has a surgical effect. So UltraTight, it's a great procedure. It's that niche product in between totally non-invasive and totally surgical, and for a guy like this one, a great result. So you'll watch our video. If you have any questions, give us a call here at the 5th Avenue Dermatology Surgery and Laser Center. Thank you.